very good afternoon, all of you. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be doing really good. So today we are here to do a very important session, an Insta Live on the topic acne management. Now, acne is something which looks like a superficial a problem related to the surface, related to the skin, related to the appearance, which in fact is true, but deep down it do affects our self-confidence, our self-esteem, and many times people go into depression because of this chronic skin condition. So it's important to know what to do and what to not to do when you have acne problems. So today we'll try to discuss all of it, and for that we are going to be joined by Dr. Ashwini S Kandikatla from Bhiwandi, who is MBBS, DNB Skin, DVT, gold medalist, aesthetic dermatologist, and hair transplant surgeon with many years of experience. And she is also the co-founder of Sadhvi Skin Clinic, Bhiwandi. So today we'll try to seek solutions or know how to manage acne. So for that we need to understand what is acne, why it happens, what are the various grades, how can we prevent these acne, and as a teenager or as a young adult, because we all are so prone to this acne. I mean, most of us has gone through that phase during attaining puberty. So we all know it's a phase of life, but then how to deal with it in the correct manner. So this is also going to be one of our concerns, what to eat, what not to eat, how to stay healthy, and how to prevent acne, and in case we have acne, how to manage acne. So this is going to be our topic of this very Insta Live. So in case you have any questions, then you can write your question in the comment section. We'll try to cover it as well. So we are soon going to be joined by Dr. Ashwini S Kandikatla, and with her we'll try to discuss that how to maintain a good skincare routine, how to make our skin barrier more strong, so that we can prevent acne in an effective way. Plus, what is how can we not fall for these market gimmicks, because these days, you'll also agree with me, market is flooded with products. So in the name of skincare, in the name of Korean skincare, in the name of so many other skincare routines, the market is flooded with various products, and it's important to understand what to do, what not to do, whether to fall for these products or not. So we are equally concerned about it. And sensitive skin is a very common problem these days, probably because we are experimenting a lot with our skin in terms of products. What are the falls that we are making, with which we are making our skin more sensitive, and be in case we have a sensitive skin plus acne issues, what to do then? Plus acne vulgaris, because as we were discussing, we all go through that phase, most of us. But then it's also important to understand why I need to go and seek the help of a qualified dermatologist, because acne anyways will subside, but then the post-acne pigmentary marks, the scars, the pits, they stay with us for most of our lives. So in case you don't want to have those scars and pits and marks, it's important to get it treated properly, get it treated on time. That way we can avoid having those scars. And even if we have those scars or pits because they look really bad, in that case, again, what are the treatment options are there? Plus, we all have this tendency of, going for home remedies, etc. We'll try to discuss that as well. A very warm welcome to you, Dr. Ashwini. What is acne? Why it happens? Or what are the various grades or types of acne?
Okay, so a very good afternoon to everyone who has joined the session. So I would quickly like to introduce myself first. I'm Dr. Ashwini Kandikatla. I'm an aesthetic dermatologist and a hair transplant surgeon practicing in Bhiwandi. So your first question was, what is acne? All right, so everyone knows what is acne. It's a layman, basically the layman term is pimples. It's basically, if you go medically, it's basically a disorder. It's a chronic inflammatory disorder involving the pilosebaceous unit. So what do you mean by pilosebaceous unit? It's basically the oil glands on our face which are attached with the hair follicle and a muscle around it. Okay, so the disorder related to this part of your skin undergoes inflammation and leads to a condition called as acne. So yeah, we are dealing with this topic today.
Yes. Doctor, we see many, progression of acne. Like as a layman, we see those blackheads, whiteheads, then bigger bumps, then, pimples, what we call, which are more painful, then a literally big nodule kind of an acne. So are these the various grades? Would you like to shed some more light over that?
Okay, so firstly, we should know why do we get acne. So the reason why you get acne is because there is a chronic inflammation happening in that part, which I said, the pilosebaceous unit. Over
Hmm.
there, you have the influence of hormones in your body. So because of hormones, the hormonal disbalance that you face, there's increased oil production. Because of this increased oil production, you will develop acne. Plus, in that pilosebaceous unit, you have something called as bacterial proliferation. So this bacteria called the P. acne bacteria, Propionibacterium acne. This proliferates under a condition where there is more oil in your skin. That will lead to the bump, that is the papule, that is the acne, that's the pimple that you get after proliferation. Furthermore, if you keep, there's a chronic inflammatory cycle which keeps happening in your skin because of the disorder of the follicular desquamation. That's because the follicle gets plugged because of the disorder, and further you develop the grades of acne. So the first grade would be, the term which you know as blackheads or whiteheads. These are nothing but comedones, the initial lesions of acne. At that stage, you call it as stage one of acne. Then you go to stage two when there's more inflammation. Then you get the inflammatory papule, which is actually the pimple. Further, when it progresses because of the bacterial proliferation, you get a pustule. What is a pustule? You have pus in that papule. Basically, the papule enlarges, becomes filled with pus, and it becomes a pustule. Further, if it keeps increasing and if the body is not able to cure it, you get a bigger lesion, which is called as a nodule, which can further become a cyst. So that becomes a grade 4, the most severe form of acne, which is called as a nodulocystic acne. So that's
Right.
pretty grade acne.
Okay. We all know that a good skincare regimen is what we need to, make our skin barrier more strong, and in a way we can prevent acne.
Yeah.
Now, keeping in focus acne, doctors, specifically because market is flooded with products, and in the name of skincare routine, we are having so much, trends going on, etc., Korean skincare regimen,
Correct.
etc. But it's, I mean, practically speaking, they are not something which we can be more consistent with. So
Yeah.
we would like to know about a skincare regimen which is more basic, minimalistic, with which we can be more consistent with.
Okay. So, acne prone skin. We're talking about acne. So we'll go
Right.
with a regimen which is suitable for an acne prone skin.
Hmm.
So yeah, so this in this kind of skin, you basically need to know what your skin exactly needs. Firstly, if you need a medical treatment, you definitely have to visit a dermatologist for your treatment. Apart from that, if you have an acne-prone skin but you don't have acne, so you need to know what exactly your skin needs on everyday basis. So, firstly, I would like to highlight something which is very important: cleansing your face. So, for an acne prone skin, depending on how your skin is at that stage, you need to have something which has a little salicylic acid in it, which should not be too irritating because it will unclog your pores. That will help you. Then, secondly, you need to moisturize your skin even if you have an acne prone skin, because your skin tends to produce more oil if it becomes too dry after washing your face with salicylic acid.
Hmm.
So, yeah, a product which should be gel based. A gel based moisturizer is something which I would recommend for acne prone skin. Furthermore, I would like to emphasize the need of sunscreen even in a patient who has acne or acne prone skin. So using a light formulation or a water based or a liquid formulation of sunscreen is something I would recommend. Which some of these are a combination, like moisturizers with sunscreen. You can go for something like that, or maybe something which has things which are enriched with niacinamide, or certain products which are also useful for acne. So such products would be recommended by me. Yeah.
Okay. I'm sure you'll also agree with me that we, people in our society are so obsessed with the home remedies. Plus, we have these DIYs these days. most specifically because there are so many influencers on various social media platform, and most of them have something or the other to tell about our skin, and we fall for it. So starting from applying toothpaste to garlic to lemon, lime, etc., we do everything.
Yeah.
Then we have these nearby chemist shops. भैया कुछ पिंपल हो गया है कुछ दे दो, and we'll start applying those topical applications for months, and initially we fall for it because they work like a magic cream. But then we understand that we are now an addict to it. So what's your stand on these home remedies, DIYs, or over-the-counter topical applications?
Yeah, I'm sure that there are many people who fall for all these things. Yeah, there's a tendency that you see the videos and watch people getting, cured in like one toothpaste. And yeah, I do understand people have that, feeling of getting rid of it very quickly with these remedies. But I definitely emphasize people like I recommend people to always be safe, because these things have a lot of side effects too. Like you really don't know which thing will work for whom. So firstly, I would never recommend somebody using a toothpaste on the face. Definitely it's it can burn your skin, you can have side effects, you can have pigmentation. You should not put lemon on your face, it's very irritating for the skin. You have other forms of vitamin C instead of putting lemon on your skin. So yeah,
Right.
vitamin C serums which do work for skin, so definitely not recommended. Yeah, these are many things which I do not support, and I would really would want people to know and be more educated and understand these things, and instead of falling for the tricks.
Right. And topical applications, how bad can they go?
Topical applications of
The creams that, I mean, over the counter applications, what we get from a chemist shop. It may be a steroid based cream, or, what we are using so rapidly.
so I really emphasize and want people to understand that acne is not something which is normal. It's not normal. If you're getting acne, you need to be treated for it. So you should definitely go to a doctor, understand your skin, what your skin needs, and what exactly you do about it, instead of going to a medical and just buy a random cream. So these creams do contain steroids. They have strong steroid in it, and people do fall for it, and they keep applying it, and then you have a very bad skin which is thinned out, will which will be irritated. You have photosensitivity, so many problems with steroid application. And yeah, I still have many patients still using steroid for their acne, and since a very long time. So it's really, it feels, it still is, a myth that you can get treated very easily with just these creams available in the market. So yeah, people should come to a doctor, visit them, and get treated instead of falling for all these. Also,
Right. So it's
parlors
important.
selling these unnamed, like the bottles which don't have any names on it, and it has some cream in it which makes your skin glow and all of that. So even that, I want people to understand that you should not use something which does not have a content written in it. So it's very dangerous.
Right.
It can cause a lot of side effects. Yeah, we need to
Right.
understand these things.
It's important to understand the root cause of your acne, and for that you need to go and consult with your with a qualified derma. They'll help you understand your skin, understand your skin issues, and of course treat them, and also tell you how to maintain a good skin. Now, doctor, we often get to hear so much about what to eat and what not to eat in relation with acne.
Yeah.
So, any dietary precaution, anything that we can omit from our plate or include in our plate?
Yeah. So yeah, I do support this thing that it's actually scientifically proven that your diet can affect your skin. There's a lot of correlation with it. Something which is very strongly proven is milk products. I've seen that many people, after consuming milk and milk products, like the heat, chas, everything, can exacerbate acne, because there is a scientific correlation where milk has something called as insulin-like growth factor. So this IGF, that can cause increase in oil production on your face, in your body. So of course it has to be increase in oil production will further aggravate, make your skin worse. So that is one thing which I really recommend stopping if you have acne prone skin. Secondly, sugar. Like sugar and anything which is sweet can also affect your skin in many ways. Be it acne, be it aging, loss of elasticity, and a lot of things. So yeah, sugar is something which I don't recommend in a patient who has acne. And yeah, so these two
And
things are the
what
main
to
things.
include
So
in
to
our diet?
include, yeah, it's said that you should have a balanced diet, of course, for acne as well. So you need to include zinc in your diet. Zinc will help with acne. It has an anti-inflammatory properties. Something which has zinc in it, like carrots, fish also has zinc in it. So that's something which you should include. Apart from that, you can, of course, include green leafy vegetables. That's considered good for your skin. Yeah, these things, and something which really hydrates. One thing is you should not neglect having water. A lot of water will definitely help hydrate your skin and maintain your skin.
Fair enough. Doctor, acne is one thing, and post-acne marks and scars, especially those pits, they look like the bigger challenge.
Yes.
A, how to prevent having those scars and marks, and B, in case we have these scars and marks, what are the treatment options for that?
Okay. So now, post acne scarring that we're talking about. So, firstly, how do we prevent it? Definitely, you need to get your treatment started as soon as possible. Even
Mhm.
but young, like many people are scared when the patient is too young, below 12 years, somebody who's too young and getting acne. Parents are very much skeptical about getting treatment for these patients. So to start early is the best thing to prevent it, of course. Start your treatment early, have a good regime, uh, you know all these things. Firstly, to get your
Mhm.
quickly. Secondly, if you have scarring, it depends on what stage you are and what kind of scarring you have. So there are three types of scars. Like very short, we can like analyze. One is ice pick scars, which are very deep ones, which are small and tiny. Then there's something called as rolling scars, and there's something called as box scars. So there are three types. According to what type of scar you have, predominantly, we think of a like a regime for you. So you have many options. You have firstly, if you want to just go with something which is not procedural, if you want to maintain your skin, best thing is to use a retinoid for life. Like that will help your skin heal from inside. It will produce more collagen. Your skin will become more stretchy, like become more elastic with long
Mhm.
use of retinol if somebody is not into procedures. But if we go to procedures to get yourself treated, there are many
Mhm.
options. The one which I support the most is microneedling with PRP. So there's something called as microneedling with radio frequency and just microneedling. So it depends on what type of scars you have, definitely. Apart from that, there are other things like CO2 lasers. You have chemical peels that will help with scarring. Yeah, so these things, depending on it, is of course tailored according to every patient's need and requirements.
Mhm.
That's how we treat.
Okay. There is a viewer, Harshita Solanki. Her question is, how can I manage my stress level? Because I have heard that stress can worsen your acne.
That's definitely true. So everyone has stress. Yeah, the acne itself can cause stress. You get an acne,
Right.
it's a cycle. Like you acne on
Yeah,
just
which is cycle.
for
Yeah.
your important day, you have an acne popping out. So that's like a vicious cycle which goes on. Of
Right.
course, managing stress is important. How do you manage it is definitely your way of managing. I personally recommend having a very good sleep. To have a
Hmm.
8 hour interrupted sleep will help you heal from inside. So one thing is to have a good sleep. It will definitely reduce your stress level. Secondly, have some kind of exercise in your in your daily routine. I recommend going for a walk in the morning, or for a brisk walk for 20 minutes. That helps you keep your health under check. So that's one thing which will help reduce. Thirdly, if you can meditate, that's a very good option. Fourth, if you can do yoga, it's of course even more better. So there are things to manage these things. That's how we can cope up with stress.
Okay. And doctor, before we wind up the whole session, any take-home message for our viewers?
So yeah, take home message would be definitely, first and foremost, do not consider acne a normal phenomena. Like it's not just a pimple. It's not just a, you need to get yourself treated. Just comedons, even if it's just two or three acne, anything on your face can lead to scarring at the end. Like you might be left with something which may not go away from your skin. For example, like those scars that we were talking about. So yeah, I recommend getting yourself treated as soon as possible. Visit a dermatologist. Do not go for DIYs, and definitely do not apply creams which do not have names on it. So yeah, these things which I would like to emphasize.
Right. So in case you want to get your acne treated on time, have less chances of having those big scars, spits, and post acne inflammatory marks, the pigmented things, please go and consult a qualified dermatologist on time. So as soon as you see the eruptions of acne, please go and consult a doctor. They'll advise you. Thank you so very much, Dr. Ashwini, for joining us and for making this session so informative. It was short and sweet. Thank you
Thank
very
you.
much. Thank you. And viewers, thank you for your active participation. Stay happy, stay healthy, have a great day ahead, and take good care of your health and skin.